Niagara Hospice provides expert comprehensive care to patients and their families to alleviate symptoms and give support at the most challenging times of patients' lives. And we're able to do this at home or in any setting. Before we go out and meet the patient, is we do have people working behind the scenes very quickly, gathering medical information, whether it's from their primary care provider or oncologist, pulmonologist, but we are gathering medical records so that we're able to get a pretty good picture as to what's going on with the patient before we even get there. We send the social worker out right away and they meet with the patient, explain the program to the families, discuss the benefits that hospice has to offer. Following that social work visit, we have an RN come and evaluate the patient. And really their job is to just do a head-to-toe assessment of the patient, evaluate them to see if they are appropriate for hospice and what their immediate needs are and symptoms. Also, if the patients aren't meeting criteria for hospice, not only do we educate the family and the patient on when to maybe give us a call back, but we do follow up with them and we make sure the families are okay with us calling maybe monthly or every couple of weeks and just checking in on them. And a lot of times they're eligible for other palliative care program pathways. So we're able to then refer to our Pathways Palliative Care Program and maybe give them some benefits. The feedback that we get from them, most patients and families say that they wish they would have called us sooner. I think I would tell patients and their families who were maybe eligible for hospice but were a little hesitant that really the benefits would be that if they want to stay in their own residence and avoid hospitalizations, we can treat them in their home. And really that is the best thing that hospice does for patients. The most rewarding thing, I think, is that I'm able to meet patients at some of the worst times in their life, and when you leave the home you have them actually so grateful for what you did for them, helped them and enabled them to care for their loved ones.